Patients in Suffolk are being urged to do their bit to help take the strain off local NHS services by making greater use of their pharmacists. With the NHS facing unprecedented demand from users, while also under pressure to manage costs, health officials believe that even small changes in behaviour could reduce the burden and free up more money for patient care.
Simple things that patients can do to actually try and help the health system at the moment are both in sort of self-care, so ensuring that they have medication in their own home to actually look after simple sort of coughs, colds, sort of diarrheal illnesses like that. Equally, by sort of easing pressure on general practice or out-of-hours services, they can actually readily access sort of healthcare advice from pharmacies, and that will considerably sort of take the pressure off your local general practice services.
GPs are clogged out with all the coughs and colds and things. Those type of things, minor ailments, don't need the doctor. They've been treated quite nicely over the counter with cough and cold remedies, or with, in the summer it's always hay fever remedies. You don't need to see a doctor for that. You can come to your pharmacist and we can give you the advice that you need on that.
Pharmacists can sort of contact their local GPs to discuss, patients or medication sort of matters, with them. But obviously sort of they can sort of help with many of the sort of medication queries that patients sort of have. And it's estimated that perhaps sort of 10% of sort of a GP's time may well be taken up in sort of dealing with medication matters that could be very, very adequately dealt with by a pharmacist.
Anne King regularly uses her pharmacist to buy medicines over the counter and seek advice for herself, husband Stephen and daughter Hannah. She says the service has been invaluable to the family, not least because she can walk there.
Well, we prefer to use a pharmacist because I don't have to wait for an appointment. And actually when we get to the doctors, it's a long trip to get there, and the doctors are always dreadfully busy.
Yes, I am seeing more people come to your local pharmacist. I mean, in this kind of environment where it's quite a relatively small village as compared to a big town, people are using their pharmacists more because we're really accessible. You don't need an appointment to walk into us.
Local NHS leaders believe that even simple changes, such as buying paracetamol over the counter instead of through a prescription, could save thousands of pounds.
Some prescription medications that are provided by a GP can actually be sort of delivered and bought over the chemist counter far cheaper if you actually sort of have to pay for your own prescriptions, but actually even if you don't sort of pay for prescriptions, it's actually cheaper for the NHS.
Changing patient behaviour can never happen overnight. However, this local NHS believes that even small changes can have a massive impact when added together.
We have estimated sort of by a campaign that we've run in the Ipswich and East Suffolk CCG, trying to encourage patients to buy simple paracetamol over the chemist counter from their local pharmacist. That can save, we believe, about £200,000. Obviously, we know that the system is financially challenged by all the reports that have been in the media, and clearly there are some very, very difficult sort of rationing type decisions that will need to be made if we don't make sort of savings in simpler areas.